righteousness. I want your promises, joy and peace. I want your promises. I need your promises. I want your promises, joy and peace. You said I could have it if I believe, so I believe. I want your promises. I want your promises, every single one. I want your promises. I agree with you, Jesus. You said I could have it, and I want your promises. I need your promises. I want your promises. Everything you said in your word, I believe I can have it, God. Hallelujah. Hallelujah. I need your promises. I want your promises. And I need your promises. Every single one of your promises. Everything you said, everything you said, I believe. Hallelujah. Hallelujah. I want your promises. It's for a shame. I want the filthy things to exchange. The throne of righteousness. I want your promises. Joy for a pain. It's for a shame. I want the filthy promise to exchange. I want your promises.
Good afternoon, AEC family, and welcome to the afternoon program for our virtual camp meeting. We hope you've enjoyed the services all week long, and earlier today we heard a powerful message from Elder Wright. And now it's time that we are going to have a discussion. We're not just about praising and preaching, but we also want to be very careful to make sure our members are informed about what's going on, things that can help them make healthy decisions. And that's why we're here with this discussion this afternoon. And I want to bring my panel on with us. We have our three doctors here, Dr. Milton Brown, Dr. Patrick Prairie, and Dr. Irvin Westney. We thank them for being here today. How are you gentlemen doing?
Doing fine.
All right, praise God. Thank you. Thank you all for being here. And those who joined us a few months ago, you remember this panel, and I'll tell you a little bit about them in just a minute. But first, we're going to open up with a word of prayer and jump into our discussion. So if you'll bow your heads with me. Heavenly Father, we just want to thank you again for the blessing of a Sabbath day. We thank you for this opportunity to come inside and focus on you and the things that you would have us to do to be better Christians. And now we ask that you would join us during this discussion. We ask that we will learn something that will help us to make healthier choices in our life, Father. And we thank you for this panel. We ask that you will be with this whole process. In Jesus' name we pray. Amen. Okay, as I said before, we have an esteemed panel with us. They are part of our medical advisory team for Allegheny East Conference during this pandemic. And I'm just going to give you a few facts about each one of them. And they shared this with you when we first spoke a few weeks ago. So we have Dr. Milton Brown, who has a PhD in organic chemistry. He spent 20 years developing new medicines, and he's still doing that, even doing some now for COVID. He's a professor of practice at George Mason University and the CEO of Trocar Pharmaceuticals. I think I got that right. And we also have Dr. Patrick Prairie, sorry. He started off his medical career in emergency medicine, which he did for 18 years before transitioning to occupational medicine, which is what he is doing now. He's the medical director for an agency in Prince George's County. So we thank him for being here as well. And then we have Dr. Irvin Westney, who's an emergency physician. He was trained at the University of Maryland. He's been in practice for 25 years. And Dr. Westney, are you still in Arizona, or are you back from your assignment there? I know when we last spoke, you were in Arizona. Are you back now?
Yes, I'm back. I ended that assignment for about 2 months.
Okay, great. Well, welcome, panel. We appreciate you being here, as we said before. And we just want to dive right into the conversation. There's so much we're hearing in the news about COVID-19. So many theories have developed even since we last spoke. So we're just going to start off with a quick update. What has changed since we spoke maybe 4 or 5 weeks ago? Is there anything new about COVID that we need to be aware of? Or pretty much the same situation, and we just need to continue to be cautious.
I'll go ahead and start this year. That's a very good question because sometimes it's confusing.
Breaking up a little
But
bit.
I'm here to tell you from the beginning that as far as COVID-19 goes, coronavirus that we've been facing, it has gone nowhere. It is still there. It is, if anything, we're finding that 32 states right now have increased numbers of cases. In fact, some more than triple the number of the high levels that they had up to 2 months ago or a month ago. We're in a tremendous surge in this country of positives. What does that positive number mean? It means that about 5 out of every 100 people that contact this virus are going to die. That's what that means. About 5%, 5 to 6% of the population that gets COVID-19 will die. They've made a few inroads with treatment, but basically the outcomes have remained about the same. They're able to help somewhat with the length of the serious illness that individuals get with COVID-19. But generally, it still remains about the same as it has been. There's an impression that this thing is only going to go away. It's going to disappear. Well, that's not happening. If anything, it's getting worse. But seems to be getting worse here than in other places. I'm sure that's something that we'll probably talk about a little bit later, but I just want to lead off by saying, please don't think for a minute that this virus has died down or gone away. If anything, it's the reverse. It's getting worse.
Yeah, that's a sobering reality. Anyone else want to chime in? Dr. Brown? Let me just unmute you.
Well,
there you go.
Happening with this virus, and I will say absolutely nothing has changed. We still need to get between 60 and 70% of the U.S. population to be infected. The population in the United States is 330 million. So we need to get around 230 million Americans to be infected before we see the virus begin to wane. We're currently at around 5 million. If we say we're under counting by 10 times, so let's say we're at 50 million. We still need to get to about 230, 250 million people. The second thing is, as Dr. Cray said, we don't have an effective therapy. Remdesivir is used for emergency use, and it drops the hospital stay from 15 days to 11 days. It drops the death rate from 11% to 8.9%. So it's still not optimal, and we do not have a vaccine. The thing that has changed that worries me the most is the spiking, and that means that we have a lot of cases now because we have reopened, we've stopped social distancing, and many people have refused to wear a mask. And what I heard 2 days ago from my colleagues is that we now have identified a much more virulent and much more aggressive mutant of COVID-19 that is now here in the United States. And that may be a part of this reason why we're having this very aggressive spiking as well. That maybe that's being mixed in with the rest of the group. The last thing I will say that's changed with this virus is that the age of infection has dropped from 65 years down to 37. So the average infection age now is 37. So we once said it was just a disease, an infection for the elderly or those who are 65. We now know that the virus now has an average age of around 37, and I would be surprised by the end of the month if it's not down into the 20s, that the average age will be 20s.
Wow. Now, I know this came up before when you mentioned a certain number of the population that needs to be infected. Can you explain to us again why we need that number to have contracted COVID before we see it go down again?
Yes, Latasha, it's simple. The issue is about vectors. In order for the virus to infect, it has to have a person or a vector in which to infect. And so the rates will begin to drop as you begin to get immunity, as patients, especially if we got a vaccine, that would greatly aid on the herd effect. But the effect is that you have to, if you can get enough of the population infected, that you will drop the number of vectors and you will begin to see the number of infections begin to drop significantly.
Okay, thank you for that.
I think one of the things that Dr. Brown is bringing out is that once a person is infected, then there's an assumption that there's immunity. We don't know how long that immunity lasts. We know effectively yet if it's one time and you don't get it again. Some reports come out that the virus is the people who've had the virus are being reinfected. But that's the concept that he's giving, is that once you're infected, then there's an immunity that should develop in you that would keep you from either spreading this or getting it.
Okay, thank you.
And Natasha, that delves into a question our listeners and our audience has asked about, can I get infected again? And so Dr. Cray brings that point out, that you can definitely be infected again. You can be infected because you didn't get the antibody memory from your first infection, or that you got infected. Now we know there are other mutants of this COVID-19. It's not just one. And so you may get another virus, mutant virus that you don't have antibodies made for. And that will contribute to you being reinfected again.
Go ahead, Dr. Wesley.
Hello, everyone. I just wanted to make a couple comments with regards to this. One of the things that are occurring in this country that other countries or other parts of the world really aren't experiencing is the fact that we have not had a federal response to this, meaning we have not developed, as far as the country is concerned, a uniform response or mechanism of dealing with this. And so as a result, we have different communities at different stages. And so right now, for example, we are seeing a spike in Texas. There have been reports which states 20% of the people in Texas who test are positive. And so initially, Texas was doing pretty well. The same thing with Florida. And so what we're having now is ebbs and valleys, peaks and valleys in different parts of the country, because we are all at different levels. We all have developed our own system for dealing with this, and it's a large country. That said, somehow Europe has been able to decrease their levels. They had a peak, then they came down, and they've been able to maintain a low level. Well, how have they done that? Well, they have, one, had a uniform response. Two, they have practiced safe measures, and that would include hand washing. That would include hand washing. That would include keeping safe social distancing. That would include the use of hand sanitizers, and it would also include staying away from large groups. And that has been occurring on a more uniform fashion in other places as opposed to here. Now, we can't control what happens throughout our entire country, but we can control what we do as individuals. So I would recommend that we, look and see what's been working and try and emulate that behavior.
I'm glad you brought that up because, a lot of our states, even within our territory, are starting to open up. Everybody's been looking forward to the green. And as soon as the state went to green, they were out as though COVID went away in one day with the flick of the green light. What is your recommendation?
Let me make one more
Sure,
thing.
go ahead.
And that is that the other thing that has been found to be very significant, and we need to recognize that, is that the avoidance of enclosed areas. So if you have to meet with a large group of people, at least let it be outside, okay? Maintain your social distancing, but if you're outside, there's much more air, and you do not have to take the risk of rebreathing the air that someone else has utilized in an enclosed space. And so that's the other thing that we need to, what we can do is we can manage our risk. And that's what we need to try and do as individuals. Try to put ourselves in situations which limit our risk as much as possible.
Okay, thank you for that. Anyone else want to comment about the reopening? I think people are missing the point. They think that because our state is open, that means that COVID must be under control somehow. How do we get people to understand that these measures are still necessary? Protective measures.
Well, I'll go, Natasha. I want to piggyback on something that Dr. Wesley said about the closed space. That's very, very important. And it leads to an issue of dealing with public bathrooms as we begin to open. The issue is that, we now know COVID-19 is a multi-organ disease. It's just not a lung disease. It attacks the gut. You first see your symptoms with loss of taste, and that's a part of the GI system. The second part, you will see patients have diarrhea and nausea and vomiting, and those patients tend not to do well. In fact, a study out of Wuhan said 204 patients, 49% of those patients didn't do well when they had GI symptoms. So that tells us that we have a GI infection that is caused by COVID. And now we have found live COVID in the feces. And so that brings us to the point that public bathrooms will be a potential place where you can really get infected. I mean, restrooms are already grungy and at the best of times, and now we have to deal with COVID there. So I really want to alert our listeners to the threat that the bathrooms, because of the closed space of the bathrooms, they represent a really problematic issue. One study recently described that when the toilet is flush, that the particles can be in the air. They found them in the air at least 30 minutes later, up to 2 hours later, and that from one flush. This was a study done in June, middle of June, that showed that the COVID-19 particles are lifted into the air about 3 feet from each flush. So healthcare advisors professionals are advising that you close the lid before flushing the toilet, which brings on another issue of touching surfaces in the bathroom. And then the last issue that I want to bring up is just encountering others in the bathroom. Please, if a person is in the bathroom, they don't have their mask on, it's just best to leave and wait for them to leave the restroom area, because the bathroom situation, although we haven't proven that a infection has occurred from the bathroom, it is a real public health risk, and it's one that you're going to face because of the enclosed area where the virus actually can infect you. So I want, as we open up, for us to really consider the bathroom. And I have much more to say about that one, but I just wanted to bring that issue up. It's a really important issue, and one in the reopening process, whether you're in an enclosed area in a restaurant or enclosed area in a bathroom, that the opportunity for you to be infected because the virus particles are in the air is multiplied. And so, when you're in the bathroom, don't touch the sinks, don't touch the surfaces. Please don't touch your eyes, your nose, your mouth. Um, and we need you to wash your hands. Even maybe you may have to start bringing disinfectant wipes with you. Some have said don't even use the hair dryer, the hot air dryer to blow your hands, because that actually blows the virus into a place that gives aerosols more access to you breathing them. So
Wow.
the last thing I want to say about this part, and this is one that Dr. Westney just talked about as well, but the issue of being asymptomatic, people who can be infected with the virus can have it 2 to 3 days. They can be infecting people 2 to 3, 4 days before they even have symptoms. They're infective. They're able to spread the infection 2 or 3 days before they even show up with any fever or any cough or anything. And so we have to be very vigilant at this time. Wear a mask. I saw a nice saying. It said, just like we talk about click it and ticket. You know that, Latasha, we see that on the
On the highway.
on the highway. It says click it and ticket. We want to mask it or casket. Mask it or casket.
Yeah, that's telling it like it is. That's pretty straightforward. Now, we are getting a few questions in the chat, and one of them, Dr. Brown, you mentioned earlier that there are different variants or types of coronavirus present now. Can you share how many types there are right now that we are aware of?
Well, we know there are at least 3 variants. We knew there was a variant that came from Europe. There was a variant that came in through New York. There was a variant that came from Asia that came in to Washington State. But 2 days ago, Dr. Fauci described another variant that's much, much more aggressive. And it is believed that this variant has figured out how to infect young people. And so this is an issue that we are really, really watching. It's been announced now. We know it's there. We know it's much more infective than the first 2 that we've experienced. And in fact, there was a hint that they're not sure that this real incredible boost that we're seeing in infections may be contributed by this variant, but it's been identified. Now in China, they identified 3 months ago, they identified 30 variants in Asia. They have identified 30, but they're not all here. They're not all aggressive. But we have one here that's very aggressive, and it is believed that it has figured out how to infect young people. And if that's the case, we have an issue when it comes time to open schools and universities and our.
Absolutely. Thank you for sharing that. Um, Now, we talked about the spikes and we talked about the fact that, the US seems to be seeing record numbers compared to some of our other countries. What do you all attribute that to? Why are we so special that our numbers are higher than other countries? What is your take on that?
Well, as
Let's
stated, I
start on it.
think we do not have a uniform response.
I think that
We are not practicing as a group of people. We are not using the face masks. We're not utilizing, staying away from large groups of individuals. Large groups of people coming together on a large scale. And unfortunately, a chain is only as strong as its weakest link. And so I think what's happening is we're having, it's controlled in certain areas, but it's not controlled in other areas because of this reality.
Okay. And we talked about also the fact that some people are asymptomatic, don't even realize that they're, carrying this virus. Um, how do you know? How does someone know when they should get tested? What are those markers that we should be looking for?
If I could respond to that, at least give a first shot at it. Um, Testing should occur. First of all, I will say once again, since we don't have, I work at a number of facilities, and each one has, different protocols, and so if you read, you may read different things at different places. That said, if you have symptoms of COVID, and those symptoms are very, very wide. We've talked about some of them: nausea, vomiting, diarrhea, loss of taste or smell, headache, shortness of breath, um, diffuse body aches, all those things, feeling tired, um, and there are a few others. If you have those symptoms, and that is a reason to get tested. The other things that could be a reason to get tested if you are in close proximity to someone who is at risk, someone who has a number of comorbidities like, diabetes, obesity, um, just people with chronic illnesses, and you want to make sure that you don't infect them. So when you're getting tested, you want to make sure each one of us needs to make sure that we don't transmit it to someone else, because we all could have it. Okay. And so, as Dr. Brown mentioned, many people who have had it didn't know they had it. And then there's some people who have it who are extremely sick. So but the main instance, as I said, two things: if you're having symptoms, or you're involved or in close proximity with someone who you need to know, so that you don't infect them, because they're at higher risk for having a terrible reaction or response to this infection and inflammatory process.
If I would add one more thing, Dr. Wesley really described that very well. And if I could add one thing, if you've been to a place that has been reported to have exposure, then you need to go and get tested. If you've gone to an event, whether it's Black Lives Matter, or whether it's a political act, or you've gone to some type of party or some type of place that has been reported to be that someone has been infected there, you should go and get tested. And Dr. Wesley brought up the point that if you have come in contact with the person, or someone at your job, or someone in your home, or one of your neighbors that you are having contact with has come up with the virus and infection, you ought to go and get tested. That's just a highlight to the great points that Dr. Wesley made on that issue.
There's one category of person too that we did not mention, and that is the individual who has the virus and they show no symptoms, none at all. They're a carrier. They just are carrying this thing around and they don't even know they have it. That's the one that really causes issues, because they're relating to their family members. They're kissing their 2-year-old and they're hugging their grandparent. And the potential to pass the virus on, even while they are asymptomatic, is a major, major issue. But there are some basic things that we can all do to prevent this. And, you know, these are common things. You've heard them a dozen times, and I may just remind you. The Centers for Disease Control, the CDC, has said for years, if you properly wash your hands, 75% of communicable disease could be eradicated. How do you wash your hands? Well, in the bathroom, it's a special situation. But you put the soap on your hands, you rub it into your hands, and you start singing to yourself, happy birthday to me. Happy birthday to me. Happy birthday. You sing it twice. I'm not going to sing it for you because I don't want anybody to get sick. But sing it twice. Then, you know, you wash your hands off. Literally, everything that could be is gone. You get your paper towel, dry your hands. Paper towel in your hand. Okay? Take them, turn off water, and use the same paper towels to go to the door and open and look for a trash can where you can put paper towels near the door so you can do that. Why? For a few minutes alone or talk alone, you realize a lot of people don't even stop at the sink before they go out the door.
Okay, I think we lost Dr.
May have
Curry.
lost.
Yeah, he'll come back in shortly, but I know he was talking about washing of the hands and using the paper towel, the same paper towel that you used to dry your hands, use that to turn the sink off. So try to avoid touching as many surfaces as possible.
Latasha, that was a great point that you brought forth about the washing hands that Dr. Perry discussed. But I want to create a scenario that's going to happen in about a month. And this issue is that many people are going to have to send their children back to school, and childcare places will open, elementary schools will open, high schools will open, colleges will open, and young people will be exposed to this virus, and many will be asymptomatic. They won't have symptoms, but they will bring home that virus to the home. And so I want us to clearly begin a scenario as we begin to approach this time in the year when we begin to send our kids to schools. We're going to have to clearly think about opening versus being online, and the risk that it will have for your family in regards to this virus. Now, I know everyone will not be able to keep their kids home, and we're going to have to become innovative in how we deal with this issue. It's going to be a real serious issue because we're going to be asymptomatic, as Dr. Query, Dr. Wesley talked about. They won't have symptoms. These kids won't have symptoms, many of them. But they're going to be highly infectious. And you're going to pick them up from school, they're going to come home, and it's going to be at home where the tremendous damage will be done from the asymptomatic virus carrier. And we're going to spike. We're about 50,000 now. When schools open, if they open, and definitely childcare facilities, we're going to spike into the 100,000 per day based on this accelerant. It's going to be an accelerant. And so I just want us to start thinking about it. The listeners, I want us to start thinking about this issue because this is really going to have a tremendous impact on us.
Thank you for that. Now, you mentioned the asymptomatic person, not even realizing they have COVID. How long are they contagious? An asymptomatic person, how long are they contagious? That's a question from our chat.
So I have found several studies that show that an asymptomatic person can be infective 2 to 3 days before they show infection symptoms. Sorry, and for people who get the gastrointestinal uh, uh, infection, those individuals can be there. They can have active COVID-19 in their stools for up to a month.
Wow, that's interesting to know. Okay, now also we have some other questions coming from some of the things we talked about. And of course, we're talking about schools opening up, and later we'll talk about what it looks like when churches reopen. So the question came up, how safe is safe? When we talk about safely reopening, is it even possible to safely reopen? What does safe look like?
I'll take a shot at that one. What we would like to do is to try and decrease the risk as much as possible by trying to ensure that we have policies in place that mandate, best practices possible. Face masking, social distancing, not having more than, a certain number of people. It's going to be different for each church, but having say 50% of the individuals in church. Other things that can be done is, it's been found that when you shout or when you sing, that causes a forward. It can increase the distance that a person's respiratory droplets go out. So we're looking at limiting singing, no congregational singing, and and shouting, or trying to decrease the risk of spread. The other thing, as mentioned before, is trying to have as many things outdoors as possible. So when the question is how safe is safe, once I talked about earlier about trying to limit your risk, there's no way to get rid of all the risk. And so it's going to be end up being a personal decision in the end as to what you're comfortable, what risk you're willing to take as an individual. It's we are living in different times. We've talked about before that we're trying to get back home, but home is not going to look like home used to look. It's going to look different. And when I'm talking about home, I'm talking about our worship experience. We're going to have to find a way to coexist with these new set of realities that we have now.
That being said, someone go ahead, Dr. Brown.
Yeah, if I could comment on that, I heard Dr. Irv Wesley brings up a really good point that we're going to have a new type of experience. Many people are trying to rush back to church, and granted, we love church. We love to come into the vestibule and see someone and hug them and give them five and buy handshakes and get right close to them and interact and find out how their week was. Sadly enough, we're not coming back to that kind of church. We're going to come back to a church where we're going to be wearing face masks. As Dr. Wesley said, we're going to not be singing. For many churches, their bathrooms will be closed because they don't have adequate facilities that are ventilated, and so they represent a place that will be tremendously harmful. In Maryland, and we have different rules for different states, we have a rule of right now, one person or one family per 200 square feet. So you can quickly kind of calculate what your church will represent as far as the numbers of people that will come back. There will have to be a sign-in sheet in order to social contact tracing to occur. And so, church as we represented it and knew it 6 months ago will be completely different. And I want our listeners to understand that so that there won't be great disappointment. The concept that we're coming back to what we experienced before will be different. Now, let me put some positive light on that. Dr. Westney said something very powerful. He said that we will have to learn how to coexist with this virus. That means we will become more innovative. We will become more routine as to how we deal with this virus when we choose to go out, when we choose to go to an event. We will learn how to coexist. Right now, we're not coexisting with this virus at all, and the virus is wreaking havoc on our communities and on our country.
Certainly. And it came up, we're talking about actually being at schools and churches, but what about public transportation? How safe is that right now?
Nothing is safe if there's a sick person on the bus or the train. Because Latasha, I want to say a simple word because I think we overlook this word so much. They say novel coronavirus. The word novel. That means we haven't experienced it before. We haven't seen this type of virus before. And so what we learned for H1N1, which, swine flu, or what we learned from MERS or the first COVID-1 is completely different. We've taken some assumptions like 6 feet may be enough. 6 feet might be enough for this novel virus. It might be 10 feet that's important. We're still learning how to deal with this. And so let's say you're on a bus. You're comfortable if someone in your area has the virus. And how will you know? You won't know. And so you have to protect yourself by wearing masks, by staying at a safe distance from others. Even if the bus becomes crowded, you might have to get off the bus and wait for another one. Learning how to coexist with this virus is going to be important in our way forward as we look to be safe and as we look to stay away from being infected.
I think
Okay,
a part
so
of being
in your
vigilant,
opinion, oh, go ahead, Dr. Curry. Sorry.
I think a part of being vigilant is what Milton was talking about. It's very, very, very important that you maintain what you know. Wear a mask, folks. And when you take your mask off, don't grab it from the front. Grab the ear loops. If you're breathing in and out, where do you think most of the virus would be concentrated on the mask? Right at the front, where the droplets would come to the front of the mask. So don't grab it there. Take that off by the loops and put it in the washing machine or wherever you're going to put it. Same with gloves. When you're in the supermarket, you don't know who's been touching the stuff that you're getting ready to put in your cart and take home. That's one of the places that we all go there, or the gas station, where it's smart to wear gloves if you have them. That's a good thing to do. But being vigilant. I was in the doctor's office on Friday and somebody was coughing. I got up. I'm like, I can't stay in here. And this is one of the bad things about this virus. There are so many different symptoms that you can have that folk are often passing it off as something else. Oh, I'm having shortness of breath. Oh, it's my asthma that's acting up. Or, oh, I have a sore throat. Well, maybe I didn't sleep enough last night. Or, oh, I can't taste it. I think maybe I burned they're passing off the symptoms as something else, but not recognizing that potentially it could be the virus. That's a situation, if you suspect that it is, get tested. That's the time to go and get tested. Many states now have free testing areas where you don't have to have a doctor's note or a prescription to have the test done. If you suspect that you are ill, and you have not, that you know of, been around anyone who has this illness, please, even if you've been around people, please go and get tested. It will not hurt, and the results come back fairly quickly, either 2 days or sometimes in 1 or sometimes less. You'll know whether you've had the virus so that you don't go and spread this, especially to your family or your loved ones.
Awesome. So one of our viewers wants to know, with all that you're saying, do you all feel that we should have a stay-at-home order in place right now? Why or why not?
I would say,
For
I
reasons.
would say yes.
Oh, go ahead. Go ahead.
Yes, Mel, I would say
I,
yes.
I was going to say for regions that are heavily hit, we definitely should have a stay at home. I think if we did like the other countries, for example, Canada, they only had 250 positive cases yesterday. I mean, we had over 50,000 yesterday. We do need a national plan. I think Dr. Westney was the one who brought that point up, that we're lacking a national plan that is uniformed, where one state is opening and another state isn't. We're playing yin and yang. One state will open and then they'll get, like Florida now is at 10,000 infections a day. That's just the ones that are coming in and getting tested. You could multiply that by another 10. So if it's 10,000, it's probably 100,000 infected. And so the point there is that we have to have a national plan. We can't have one state opening and another state closing, another state halfway open and halfway closed, because the infection has no borders. The virus has no walls. There's nothing physical other than placing a mask over your face that's going to keep the virus from going to different places and carried by individuals. And so we need a national plan, and that may be a challenge for us at the moment right now.
I believe that's true, Milton. I co-sign what you're saying. One of the beauties, one of the most wonderful things about living in America is that we have borders but no boundaries. And in Europe or in the other countries, any place else you go, when you cross from one country into the next, or one state into the next, if you think about Spain and France and Germany, all those countries, you have to clear. You can't just walk in. You just can't. Here, if 50 people get the virus in Florida and they want to go to Georgia or Alabama that same day, there's nothing stopping them. Our borders, we don't have any boundaries. That's one of the issues, because one state's shutting down and another one's opening up. Well, you're not stopping the people who are in the state that's increasing. You're not keeping them from coming into your state. So what does that mean? They're going to come to your state. They're going to drive across the line that separates Texas from Arkansas, or Texas from whatever else is around it, Nevada. They're gonna go. Why? Because they can. So without a national approach to this, we're chasing, herding cats. I mean, it's tough. It's very, very tough. And finally, the world caught on this week and said, "No, we're not taking any Americans. You can't come into our country. It's too much risk."
Yeah.
Okay, so
The American travel has been banned in Europe, in all the European states, European Union, and Mexico, and now Canada. So we are becoming isolated because of our rates.
understandably so. And so we have a few questions about the vaccine in our chat. People are wondering, are we getting any closer to it? Are we still looking at 18 months to 2 years for this vaccine? Should we not rely on that right now in terms of helping out with this thing?
Yeah, I'll take a crack at that. I'm gonna just be frank with my church family. We're not gonna get a vaccine very in the very near future. I can't see us getting a vaccine within 2 years, if at all. And there's some scientific reasons why. Uh, One is the spike protein and the ability of the spike protein to mutate. And when we're making vaccines against the spike protein, which is where most of the vaccines are targeted, it's just problematic. Second, there are multiple mutants, and with that comes loss of the ability to fight to have a vaccine that has a multiple viral target, and that's a problem. And then third, this virus has a really weird way of not invoking people to have a strong immune response to it. And so the vaccine may have the same problem, that we're not going to be able to get the titers high enough where we will respond to the current virus. I don't want us to put our hopes in a vaccine. Definitely not before school starts, and pretty close to 100% not before the end of the year. And I would tell you, in reality, not for another 2 years. But things can change, and we can be blessed. But to answer the question front on, not before school starts, and definitely not before the end of this year.
Hi, Dr. Wesley.
Yeah, I just wanted to add to what Milton has said. I think if you listen to this, it can be very discouraging. That said, once again, what's happened in the rest of the world, Canada that he just mentioned, Europe, they have figured out how to coexist with this virus, and they are finding a way to continue with their life, but it's changed. We need to get to that point in our country, okay? And as we expressed, it's more. Some of this is out of our control, but it's not all bad. It's just we have to conform to the virus as opposed to thinking it's going to change for us. That's number one. There are some. I did want to talk a little bit, if you don't mind, about when should I go to the emergency department?
Sure, please go ahead.
And I just want to say, if you find that you're having symptoms that you perceive as being severe, and the main symptoms I worry about is nausea, vomiting, and diarrhea, not being able to maintain your fluid intake, and so you're becoming dehydrated. That's one reason, but the more major reason is you find that you're tired, or you find that your respiratory rate is increased. Some people, it's going to vary from person to person, but some, if your respiratory rate is greater than 24, that's so you breathe. And really, generally speaking, if you're healthy, your respiratory rate should be about 12 to 14, 16, in that range. But if your respiratory rate is greater than that and you don't have a reason for it, and it's a persistent thing, that's another reason to consider coming in. If any of your symptoms are you see them as being severe, then you need to consider going in also. But you don't want to go in for a something that you don't see as severe or is not truly severe, because when you go into the emergency department, there are other sick people there. So you're putting yourself at a different risk by going. So I'm not discouraging going. I'm saying go if you feel that you need to be evaluated because you feel you're having severe symptoms.
Thank you for that. And we do have a few questions in the chat that I kind of want to just throw at you guys before we wrap up our discussion. One was about Lysol, using Lysol. Does that truly kill the germs of the virus? The germs or the virus?
So Lysol is meant to kill bacteria. And it's been shown to have some effectiveness against viruses. I want you to understand there's a difference between a bacteria and a virus. And so they're not the same. And so a Lysol was meant, you read on the label, it's meant to kill 99% of bacteria. However, some studies have shown to have some effect against viruses on surfaces. But that's what it was not meant for viruses. It was meant to be antibacterial. The other thing is that you can't put this on your face or your lips or your skin. This is Lysol. Please put the Lysol on surfaces, not on you.
Yes, we do have to say that these days. A couple more questions. So, some of us, our viewers, are looking ahead. When COVID-19 is finally over, how can we properly prepare for the next pandemic?
Well, I'll start.
Okay.
Because my colleagues are much more have a much better way of saying things. So I'm going to start and let them clean up my mess. We're gonna have multiple pandemics from this virus. The pandemic started from just the two that came, but when the economy and countries finally open up, there are going to be multiple pandemics. In fact, we're going to have two pandemics at one time here in the fall, because H1N1 is coming back again. It's just been verified that they found a new H1N1, so new flu is coming. And we need to prepare. It's going to be tough to diagnose. I don't know what Dr. Westney is going to do, and Dr. Curry in the emergency room in between H1N1 and COVID-19, because they're going to have similar symptoms, but they're going to be different viruses. And so it's going to come in the fall with the flu season. And so in to COVID-19, we're going to have multiple coronavirus pandemics that come. It's going to be I think Dr. Westney described it the best that I've ever heard. And he said, we have to coexist with virus. We have to learn to coexist with this virus. That means we have to change our habits. We have to change how we interact with others. We have to change our style. We have to change our formats. I mean, I want to say thank you to Dr. Westney for saying that. We have to learn, and we're going to have to learn how to coexist with this virus where we can be safe. And it seems like other cultures are more willing to coexist and learn how to coexist than we are. We're sometimes dogmatic. I'm just going to do it like I've always done it. That philosophy is not good. And so I hope that as we go forward, the pandemics are going to come. They're just going to come. We're going to have multiple pandemics. And so I want us to be preparing for that. Now you can clean it up, guys. I'm just
Thank you.
Came out with it.
I don't know if I can clean that up. I think you did a wonderful job, Dr. Brown. What I would say is that back in the late 1980s, we had the HIV virus. And the feeling was a lot similar to what we're experiencing now. And from that experience, we developed universal precautions. And that continues to this day. We continue with thinking that anyone could be positive. So we changed how we dealt with sharp needles. We changed our policies in dealing with patients. And we're gonna have to do that. This is a new virus that requires us to change how we do things, change our modus operandi.
I think as a part of what both of these astute gentlemen have brought forth is that a new pandemic, we won't know exactly is or how it presents. But it's very difficult to have actions we take that uncertain if we are taking kind of a kind of has started that if this had been the Middle Eastern respiratory virus, literally 1/3 of everybody who had been infected would be dead. So please understand, whatever it is we do together, if we don't do it together, we're going to face the same kinds of issues that we have. Human life has to be more important than everything else. And we have to value that. And that's why so much of the advice that we try to give in our reopening of our schools, reopening of our churches, is for the preservation of human life. That becomes more important to us than the economy, than anything else, because as long as there's life, there's hope.
Mm-hmm.
Amen.
Well
Amen.
said.
So we're wrapping up. We're at the end of our hour, but I always like to give you all an opportunity to give some final words to our listening audience, something we may not have covered that you really want to make sure they get before we leave here this afternoon. So just go around and each of you kind of share some closing remarks for us. Dr. Wesley, you want to start?
Yeah, I'll start. I want our listening audience, our family, to know, we don't get any pay for coming onto this broadcast. We come on here because we love you. We want to keep you safe as much as we can and share information that's unfiltered and without any politicals. I want you to wear your mask. I want you to social distance. I want you to stay away from large crowds. I want us not to rush back to churches and the open schools. It's not going to be the environments that we remembered from last year. We're headed into new existence. We're going to have to learn to exist with this virus. Please wear your mask. Please social distance. And we will absolutely get through this.
Thank you.
Yeah, if I could just say once again, I wish everyone a blessed Sabbath, happy Fourth. We can get through this. We will get through this. It's been a long time, but we can get through it. We will get through it. And I would like to say also that the God who created us and created everything around us also is master of the waves, storm, and this virus. We'll get through.
All right. Dr. Carrere?
Yes, I would say, echoing Milton, what Dr. Brown said, we love you all, and that's why we. I would like to say to you all, stay safe, stay away from sick people if you can, and stay vigilant. Please just don't fall into, I'm tired of being at home, so I'm going to go out and be around people. Stay faithful to what you know, what you've learned, and what you've heard. And know that you serve a protector who's powerful enough to do what you ask of him, who loves you far more than any of us do. Our God is able. Stay with him, connect with him, and you cannot and will not go wrong.
Amen. Amen. And doctors, we just can't thank you enough. One, we're so blessed to have you as part of our conference, and we're also blessed that you're willing to share your wisdom with all of us. We appreciate you so much, not just for what you do here today, what you've done here today, what you're doing for Al and East on a daily basis, being part of our medical advisory. We appreciate you so much. Thank you. Thank you. Thank you.
Thank you for the opportunity.
No problem. And to all of our listeners, we know you may still have some more questions. It's okay to email us through the website. We can make sure the medical team gets it and find a way to answer those on our COVID-19 page of our website. So feel free to email us any questions, and we will make sure our medical advisory team gets them. We want to make sure that you're safe. I hope you got that from this discussion today. Once again, thank you, gentlemen, and thank you, listeners, for being a part of this discussion. God bless you all.